Hello, this is Dr. Gay from First Look MRI. This is a 47-year-old male with complaints of knee pain, no trauma, and he has abnormal signal in his medial meniscus. So to get oriented, this is a sagittal view where the kneecap is off on the left. This big bone here is the femur. Above the knee joint, this is below the knee, the tibia. We see the ACL coming down obliquely. If we go off towards the medial side, we see something behind the meniscus. There's a little funny fluid collection here, a little cyst behind the meniscus. The meniscus is this little dark triangle, and we can see that the back of the meniscus, the posterior horn, is not normal. The front is a nice, beautiful, dark black triangle. The back, though, has this horizontal band of brightness within it, and there's a little fluid collection behind it. And so this is a meniscal cyst and a parameniscal cyst. So the signal that's longitudinal, this is just what we call degenerative signal or intrasubstance signal. It doesn't touch the top or the bottom. So if the surgeon went in there with a scope and looked, it would look nice along the top and it would look nice along the bottom. This would be invisible. So we're careful not to call it a meniscus tear, though it looks like a tear. And if we go to another view, we'll be able to see this a little bit better. On this view, fluid stands out as bright. And now we see this horizontal abnormal signal within the substance. We see that funny little cyst behind it. And if we get off to the body, the middle of the meniscus, we see this thing that's bright. We're going to put up a different view to see that better. This is a view called a coronal, where we're looking straight at the knee. The femur again is up here. Tibia is down below. We see the lateral meniscus, looks pristine, nice, perfect black triangle fitting between the femur, which is round, the tibia, which is flat, a little wedge that fits in there. But look on this side, something is not quite right. We have this glob of brightness. So this is the meniscus, but within the meniscus, there's this bright signal. And the meniscus is expanded too. This is a mucinous material that expands the meniscus, and we call this a meniscus cyst. Again, it doesn't touch the top or bottom. It may not be easily visible with a scope, but sometimes these can contact the periphery, and they can lead to these fluid collections outside. We call this a parameniscal cyst. So this is a meniscal cyst expanding the meniscus, and then along the outside a parameniscal cyst that is that some of this material is spilled outside. Here's another little parameniscal cyst. So that's it. So there's no articular surface tear that touches the bottom, top or bottom, just a meniscal cyst that's expanding it, and parameniscal cysts along the side and back of the meniscus. And that's it. Thank you very much.